Lyme transmission time is something that you have to be really concerned about because there's information out there that it takes 72 hours or 48 hours or 24 hours. Now that information was based on the fact that initially it was felt that the Borrelia bacteria that causes Lyme is found in the midgut of the tick. So if it's found, that's like having it in the stomach. And so during the feeding process, it has to go from the midgut to the salivary glands, so in order to go into whatever it's biting. But now researchers have found that sometimes that this migration process has already started, whether it's the fact that maybe the tick had an incomplete feeding, maybe it bit you and it didn't like you, and so it falls off and it decides it's going to go feed on somebody else. Well, now that process has already started. That tick will already have the bacteria in its salivary glands, so it will be able to transmit very quickly. And there may be other factors that we don't know about that show that the bacteria is in the salivary glands at the start. So that is very problematic. And the problem with transmission times is sometimes doctors will say, well, that tick was not on you long enough, so you really couldn't have Lyme disease, and they don't even want to consider it in a differential diagnosis. Well, this is something that has to change. Doctors have to realize that this isn't true, and you have to look at your patient like they have a history of a tick bite. You better be looking for different tick-borne diseases. Also, there's the situation that other kinds of co-infections, such as Powassan, are already known to be able to be transmitted in a very short period of time. They don't have the same issue of having to migrate and so on.